Today's broadcast is brought to you by Carestream Health. Carestream Health is a leading provider of medical imaging systems. Start your digital transformation with CR solutions that maximize workflow and image quality. Capture, process, and view high-quality digital images within seconds using Carestream Health's innovative DRX family of solutions. Built around the revolutionary DRX1 wireless cassette-sized DR detector, this solution can provide a DR upgrade to your existing X-ray equipment, existing portable mobile X-ray unit, or is available as a full X-ray room replacement system. For product demonstrations, please visit Carestream Health at RSNA Booth 222 at the Lakeside Center. Hello and welcome to this edition of IETV. My name is Tim Tialdo. We begin by taking a sneak peek at some of the latest diagnostic imaging products to be featured at the Radiological Society of North America's annual trade show, November 28th to December 3rd at McCormick Place in Chicago. In addition to offering a chance for those in the radiology community to network and educate themselves about the latest breakthroughs in medical imaging, the RSNA will showcase the following items. Siemens Healthcare will introduce its multi-specialty Accuson S2000 ultrasound system, Release 2.0. This newer version features powerful 2D and color Doppler imaging and comprehensive 3D, 4D capabilities. The applications include cadence contrast imaging and second-generation acoustic radiation-forced impulse imaging. The new Accuson S2000 also has an automated breast volume scanner that permits full-field sonographic volumes of the breast in less than 10 minutes. Philips Healthcare will present a new series of workflow layers for the iSight PACS, which are compliant with both the American College of Radiology and the Joint Commission. The new workflow layers are designed to improve user communication, workflow management, workflow efficiency, peer review, and ED radiology discrepancy management. Also from Siemens Healthcare comes new Singo.via imaging software intended for multimodality reading of clinical cases and featuring automated case preparation. The program comes with structured case navigation across multiple specialties, including neurology, oncology, and cardiology. The new Singo.via software is compatible with Siemens Singo.plaza, with which it shares direct, no-click access and a unified user interface. It's also compatible with the PACS and RIS offered by today's vendors. And finally, Merge Healthcare will unveil the Merge Healthcare Kiosk, a product aimed at reducing the administrative workload by placing certain procedural tasks in the hands of the patient. This standalone unit allows patients to check for appointments on their own and scan any necessary documents, such as identification and insurance cards. They can update personal information and even use the Merge Healthcare Kiosk to make payments. Today's broadcast is brought to you by Carestream Health, the makers of the DRX line of imaging products. The Carestream DRX Mobile Retrofit Kit allows companies to upgrade their existing mobile CR system to DR technology within hours. Designed to fit existing mobile units, the kit provides a non-invasive, customized retrofit solution. Its wireless digital capability increases on-site productivity and provides immediate image access in the field. For more information on these products and the entire Carestream Health line, go to carestreamhealth.com. A look now at research and treatment guidelines in medical imaging. First up, there's promising news for dementia patients. A diagnostic tool produced and distributed by GE Healthcare has been recognized by European neurologists as being a key ingredient in the effort to differentiate Alzheimer's disease from other types of dementia. The product, known as DaTscan, is a radiopharmaceutical agent used in the brain imaging technique known as single photon emission computed tomography, or SPECT. DaTscan was recently recommended for use by the European Federation of Neurological Societies in its updated guidelines for the diagnosis and management of Alzheimer's disease. Those guidelines were presented in the European Journal of Neurology in October. The guidelines state specifically that dopaminergic SPECT imaging with DaTscan is helpful in differentiating between Alzheimer's disease and dementia with Lewy bodies, a neurological condition similar to Alzheimer's, because it also involves the death of nerve cells in the brain. The recommendation was given a grade of A, the highest ranking used in the guidelines. Dementia, which refers generally to a group of symptoms including memory loss, language difficulty, impaired judgment, and reduced motor skills, affects an estimated 24 million people worldwide, but that figure is expected to double every 20 years. Officials with GE Healthcare, a unit of the General Electric company, said this trend makes it imperative that neurologists be able to distinguish between Alzheimer's and other forms of dementia. That means these professionals will rely more and more on accurate imaging technologies such as SPECT with DAT-scan to produce a definitive diagnosis. Adrian Holden, the European head of medical professional services for GE Healthcare, said in a press release the new company hopes the recommendation will result in more timely and appropriate treatment for dementia patients across the globe. John O'Brien, a co-author of the guidelines and a professor at the Institute for Aging and Health at Newcastle University in the UK, said a timely diagnosis reduces the anxiety level for patients, allowing them to understand their symptoms and receive the specific care they need. It can also improve the long-term prognosis for those patients and potentially reduce the use of inappropriate medications that sometimes have serious side effects. Alzheimer's disease is the most common cause of dementia, representing about 60% of all cases and affecting 5.1 million people in the United States alone. Dementia with Lewy bodies, named for the abnormal collections of protein found in the nerve cells of the brain, accounts for as many as 20% of all dementia cases. DAT-scan has been in clinical use for 10 years in more than 300,000 patients worldwide. It is licensed and distributed in 32 countries. That's all for this episode of Imaging Economics TV. Thanks for watching. A special thanks to our sponsor, Carestream Health. For more information on these stories and the latest industry news, visit imagingeconomics.com.